As I learned how the health system operates, I became friendly aware how easily my family and I could crumble if misfortune falls on us. My brother and I have been covered under Healthy Families, a government health insurance program for California youth of low-income families. My parents, however, were not insured. A little more than 6 months ago, when it was time to re-register for Healthy Families, my family faced financial problems. To qualify for the program, the family has to be in a certain income bracket, $1 more or $1 less, and you do not qualify. We waited for the letter of notification to arrive until our necks stretched like giraffes. Impatience turned to frustration. My parents called and left messages to the people in charge. For weeks, we waited by phone but never heard back. And so, my parents concluded that my brother and I had lost our health insurance. The 2 weeks before our health insurance ended, my parents jumped on the phone to make one last appointment for our dental cleaning. I skipped out of the dentist's office, feeling refreshed. When I got home, I looked into the mirror and saw dots of cavities still nest out my teeth. Horror painted my face. I couldn't look. I brushed my teeth like a mad woman. I didn't want to burden my parents financially. I did not know when I could see a dentist again. I prayed that the cavities wouldn't expand. The doctor's office became my family's Garden of Eden, the place out of reach, until a letter arrived half a year later. It held a line that determines the well-being of my brother and me. It stated, "Your child is qualified to stay on the Healthy Families program." The words on this piece of paper were the cue to my family to breathe a sigh of relief. Immediately afterward, I ran to the dentist, and now my teeth sparkled like sugar cubes.
After the Vietnam War, my family fled to America in search of a better life. They left with nothing. So a week after I was born in San Francisco, my family knew they wouldn't have enough money to support me. They left me with a family friend, Bác sĩ Tín Nguyen. Because he was a pediatrician, he also became my doctor. Growing up in his tiny SRO, surrounded by the despondent streets of San Francisco's Tenderloin, I never worried about things like bills or healthcare. I contemplated little things, like when I'd get to have a recess, or when my cousin would visit to play, or where the screwdriver was so I could disassemble the only toy truck in the room. And so I grew, getting shots every few months, assembling and disassembling my toy truck, drinking bitter herbal tea during the day, getting kisses from my doctor at night. At age 7, my parents had enough money to move me in with them. I quickly assimilated into my new home, but I missed Bác sĩ Tín. After moving, I could only visit him for checkups. With my blue Medi-Cal card that said, "Yes, you can see him now," I ran to him every time and gave him a big hug. We'd catch up on each other's lives as he checked my blood pressure, my heart rate, my temperature. Then, we'd hug again and be off. I wonder what life would be like if everyone had a doctor like mine. He gave me a home to live in, a strong immune system, and love. To me, what Bác sĩ Tín gave me is precisely what I mean when I say that healthcare is a human right. It isn't the bill that matters, as it does today. It's that indescribable love for life. For no one deserves to live in fear of getting sick, in fear of not being able to pay to live. If only this country that sings of life and liberty, this country that promises the pursuit of happiness, but not happiness itself. If only this country had a healthcare system that cared about its citizens' health and not of their money, then maybe we could stop living in fear of the worst. Maybe then we'd live a little happier.
My name is Betty Huey, and I am 18 years old. When I turn 19 in January, I will lose my Healthy Families Insurance, a government insurance program for youth in low-income families. Growing up, my brother and I depended on healthy families. My father and mother, on the other hand, did not have insurance. In the past, I have gone to the hospital a few times because of severe stomach pain from the flu. I could barely walk to the hospital. Fortunately, the ambulance ride was covered by my insurance. Otherwise, the hospital bill would have cost thousands of dollars. My father works in a Japanese restaurant around sharp knives and hot stoves. He works long hours and sometimes gets sick with high fevers. Over the years, he has accidentally cut his fingers while working, but he has never gone to the hospital because he does not have insurance. I remember one day, my father called and said he was coming home early. When he arrived home, he had blood-soaked paper towels wrapped around his index finger. He unwrapped the paper towel and showed me the cut. I squirmed. A chunk of skin was gone, and immediately the blood flowed out of the gash. I wanted to help him, but I didn't know what I could do. He said he was not going to go to the hospital because it was going to be too expensive. In the past, he considered buying insurance, but he was unable to because of high costs. For low-income families like mine, insurance is beyond our budget. Today, my mother has insurance through her employer. However, my father is still uninsured. Now that my brother and I are college students, we are required to purchase insurance through the universities, an additional burden besides paying for tuition. With the high cost, I'm uncertain if my parents can pay for both.
My insurance saved me when I got into an accident in 3rd grade. I crashed against a bathroom door during a play fight with another student, and I had to go to Chinese hospital to get 8 stitches. If I didn't have insurance, I would have had to pay hundreds or even well over $1,000. Good thing I had insurance. I did not have to pay any fee. In my family, healthcare is important. Without healthcare, my family wouldn't be able to afford to get medical help or checkups since we are low income. Besides, healthcare keeps my family and I healthy and less likely to be seriously sick. We don't worry about getting sick and not being able to be treated. We don't have to live in fear of an accident happening and getting a bill of thousands of dollars. Fortunately, my family does not face these problems right now as we do have health insurance. I've had health insurance from healthy families since I was born. Since my father takes care of my grandmother, he is qualified to receive health insurance through her. In the summer of 2010, while I was 14, I joined a youth program with the Chinese Progressive Association, also known as CPA. After working on CPA campaigns, I've learned a lot about healthcare and how it works. I've learned that without it, good treatment would be completely out of reach for most people. Because of this, many go to hospitals like St. Luke's because it offers a limited amount of charity care to the uninsured. I care about people without health care because I believe that health care is a human right, but I have learned that not everyone thinks this way. and the management of California Pacific Medical Center, which runs St. Luke's Hospital, is trying to cut St. Luke's by almost 150 beds. For the uninsured people who truly need it in the community, this is a matter of life or death.
Growing up, I was never too worried about visiting the doctor or getting medical care. I always had health insurance through my parents' employer or through school. If I needed to get a checkup, then I just made an appointment. It was easy. But on March 26, 2008, those carefree days came to an abrupt end. While biking home from work, I got doored. As my front tire made contact with the car door, I flew off my bike, hit my head and my arm on the pavement, and landed in the street. A bystander called 911, and more concerned strangers huddled around. When the ambulance arrived, the EMT asked if I had health insurance, but I said no. Overall, my stay at SF General Hospital lasted 4 hours. 30 minutes of x-rays, examination, and getting bandaged up, and 3.5 hours of waiting in the crowded emergency department. I woke up the next day feeling swollen, bruised, and anxious. How was I going to pay my hospital bill? How would I pay for the ambulance? I still had to get follow-up medical care, and I didn't know how I was going to pay for it. In the following days, my stress levels went way up. I finally had a glimpse of what it was like to be uninsured in America. The fear, the anxiety, the pressure from collection agencies, and the threat of going bankrupt because of medical expenses. It took me over a year to finally resolve all my healthcare bills from that one accident. It was one of the most horrible experiences, not knowing where to turn for help, not knowing financial security, all because our healthcare system is based on who can afford it and who can't.